This chart from the U.S. Congressional Budget Office shows Medicare expenses are soaring out of control and will surpass the projected revenue of the U.S. over the coming years. The chart also shows a percentage of revenue for healthcare expenses are currently soaring much faster than ever before. And according to the Organization for Economic Cooperation and Development, the United States has the highest cost of healthcare in the world. The U.S. Congressional Budget Office projects net Medicare spending to increase from $630 billion in 2019 to $1.3 trillion in 2029. The next chart shows how the costs of healthcare have soared in the past and is projected to surge even faster over the coming years. And according to Peter G. Peterson Foundation in 2018, the United States spent about $3.6 trillion on healthcare, which averages to about $11,000 per person. Relative to the size of the economy, healthcare costs have increased over the past few decades from 5% of gross domestic product in 1960 to 18% in 2018. The Centers for Medicare and Medicaid Services project that by 2028, such costs will climb to $6.2 trillion, or about $18,000 per person, and will represent about 20% of gross domestic product. However, those projections do not even take into account the impacts of COVID-19 pandemic. While the extent of the effect is still uncertain, testing and treatment costs are expected to be high and could potentially drive the cost of healthcare even higher. And U.S. spending on prescription drugs has grown rapidly over the past decade, climbing from $683 per capita in 2007 to $1,025 per capita in 2017. The Centers for Medicare and Medicaid Services project that such spending will continue to climb to $1,635 per capita by 2027, an increase of 60%. Furthermore, as more individuals turn 65, they will become eligible for Medicare, and as a result, the number of Medicare enrollees is expected to increase from 60 million in 2018 to 75 million by 2028. That expansion in enrollment is expected to significantly increase the cost of Medicare over time. In fact, the U.S. Congressional Budget Office projects that Medicare spending will double over the next 30 years relative to the size of the economy. And this chart from the Board of Trustees of the Federal Hospital Insurance and Federal Supplementary Insurance Trust Fund is the most disturbing of all. As of 2019, it shows Medicare Part A, which is your hospitalization, becoming insolvent in 2026. Let me repeat that. The government's own projection shows Medicare Part A becoming insolvent in 2026. And today, many European countries are struggling to meet the needs of their huge social welfare system. Greece's government, for instance, has a backlog of medical bills from 2010 and has failed to make payments in 2011. Spain has discovered piles of hidden healthcare debt that was previously unknown. Italy has instituted a large co-payment for its citizens to push back against its healthcare debt. And the UK has now started rationing non-urgent operations, such as hip replacements and cataracts for similar reasons. So while Europe has already started to make difficult decisions, and we can see from the earlier chart that the United States is spending far more than European countries, we must ask ourselves, will the United States ever get to this point? Well, as many do believe, the writing is already on the wall. And as the national debt continues to soar, even higher, making it more difficult for the government to provide resources for healthcare for retirees, those people that are thinking the government will be there to take care of them, I can tell you that they will be greatly disappointed and live a painfully frugal retirement lifestyle. Hi, my name is Michael Hass, and I've helped hundreds of retirees in or near retirement pursue their goals of living the lifestyle they've always worked towards and dreamed about. Acting as a fiduciary, I do not earn any commissions at all, but instead I manage my clients' assets in a fee-based relationship. So when you do better, I do better. It's a win-win for everybody involved. If you'd like to talk about how this information is going to affect you during your retirement, please click the button below to set up a time for us to talk. So that was a sobering look at the fastest growing expense in your retirement. Now let's talk about how you can pay for those skyrocketing healthcare expenses throughout your retirement years. The three sources of income during your retirement are pension, Social Security, and your savings and investments. I'm going to share with you some sobering facts about two of these retirement income sources, public and private pension sector plans and Social Security. According to Wharton University, public pensions are underfunded by $4.4 trillion. The post office alone loses billions of dollars every year. The average loss for the post office in the last 8 years is $6.56 billion. And the biggest reason is legacy costs to fund the pension plans for the retirees. Olivia Mitchell, who was a professor at the Wharton School of University of Pennsylvania, has said that every year that goes by leads to more red ink and more concern because state and local plans across the country have clearly not done what they should have done to contribute the right amounts. The next statistic is even more disturbing. In the private sector, according to an article by Floyd Norris printed in the New York Times, of the 500 companies in the S&P 500, 338 have pension plans, and only 18 of those are fully funded. 7 of the companies reported that they are underfunded by more than $10 billion, with the worst being underfunded by $21.6 billion, which was General Electric. The other companies with more than $10 billion in underfunding were AT&T, Boeing, ExxonMobil, Ford Motor, IBM, and Lockheed Martin. These are some of the largest companies in the United States, what we call blue chip companies. Obviously, there's going to be some very disappointed retirees whose retirement incomes will be much smaller than they were counting on. And here's a letter printed by the Automotive Industries Pension Trust Fund issued to its participants and beneficiaries in April of 2019 that states, "The plan is considered to be in critical status because it has funding or liquidity problems or both. The plan is projected to have accumulated funding deficiencies over the next 9 years, and the plan is projected to become insolvent in 2031. However, there is a government agency created to bail out the unfunded pension plans, the Pension Benefit Guaranty Corporation, which is a federal agency created by the Employee Retirement Income Security Act of 1974, known as ERISA, to protect pension benefits in the private sector defined benefit plans, the kind that typically pay a set monthly amount at retirement. The following information was obtained from the U.S. Government Accountability Office's website. According to the U.S. Government Accountability Office, the Pension Benefit Guaranty Corporation has over $112 billion in assets, making their portfolio one of the largest of any federal government corporation. Through its single employer and multi-employer insurance programs, Pension Benefit Guaranty Corporation insures the pension benefits of nearly 37 million American workers and retirees who participate in about 24,800 private sector defined benefit plans. The Pension Benefit Guaranty Corporation's financial future remains uncertain, due in part to a long-term decline in the number of traditional defined benefit plans and the collective financial risk of many of the unfunded pension plans Pension Benefit Guaranty Corporation insures. They designated the single employer program as high risk in 2003 and the multi-employer program in 2009. Since fiscal year 2013, the Pension Benefit Guaranty Corporation financial deficit has increased by nearly 45%. At the end of the fiscal year in 2018, their net accumulated financial deficit was over $51 billion, an increase of around $16 billion since 2013. The single employer program, composed of around 23,400 plans, accounted for a surplus of $2.4 billion, an improvement of about $30 billion since 2013. The multi-employer program, composed of around 1,400 plans, accounted for a deficit of about $54 billion. In addition, the Pension Benefit Guaranty Corporation estimated that its exposure to potential future losses for underfunded plans in both single and multi-employer programs was nearly $185 billion. According to past Pension Benefit Guaranty Corporation projections, it is nearly certain the multi-employer program does not have the needed resources to satisfy the agency's long-term obligations. So if the corporations don't have the money to pay these monthly checks in full, and the Pension Benefit Guaranty Corporation estimated that its exposure to potential future losses for underfunded plans in both single and multi-employer programs was nearly $185 billion, there is going to be a lot of retirees very short on their expected income and going to have to reduce their retirement lifestyles. Nothing anybody wants to do. Now let's talk about the second source of your retirement income, Social Security. The average cost of living adjustment for the last 11 years has been a measly 1.38%. And when you realize that inflation in most recent years has been running in 2% range, 4% over the long term, the purchasing power of your Social Security income continues to dwindle each year. And keep in mind that inflation figures the government gives us excludes food and energy, the very things we have to buy every day of our lives. And here's a whopper for you. You might want to make sure that you're sitting down for this one. In the year 2031, if our elected officials do not fix what is wrong with the Social Security system, they will only have enough money to pay out 3/4 of the required benefits to you. So according to AARP, in 10 years from now, if the government doesn't fix the Social Security, you are going to take a 23% reduction in your Social Security benefits. And research has pointed to a quicker depletion of the funds stemming from the COVID-19 pandemic. According to an article printed by CNBC website, data from the Wharton School of University of Pennsylvania estimates the funds could run out as soon as 2032. Meanwhile, the Bipartisan Policy Center, a Washington, D.C. think tank, has said the reserves could be depleted in 2028. Given the shocking information and government projections, I pose this incredibly important question to you. If your pension is at risk and your Social Security does decrease your monthly checks by 23% within 8 to 10 years, how do you pay for skyrocketing healthcare costs and other increasing retirement expenses? If most pensions out there are seriously underfunded, and the government agency enacted to ensure and protect those pensions itself is underfunded by $185 billion, and Social Security itself is in big trouble, what you must realize is that it is your savings and investments that you will be relying on to provide you with retirement income to pay for your health care and live the lifestyle that you've been planning for and dreaming about. That last comment cannot be overstated. Now, you can't control what the government is going to do with Social Security and whether or not your employer is going to be able to continue to pay you that monthly pension check throughout your retirement years, but you can control what happens to your retirement nest egg. What I can do for you is to show you how to help mitigate the costly mistakes that many investors make today by showing you how to develop a properly managed portfolio using lower cost, more transparent, more liquid, and more tax-efficient investment vehicles with little to no stock overlap. Now, you could just attempt to fix your mutual fund portfolio today and replace them with some other investment vehicles that you might choose and think your problem could be solved. Or you could use my experience to help you develop a portfolio that may provide the increasing income that you will need all throughout your retirement years. And there's always room for some adjustments in your retirement nest egg from time to time. I'm not talking about constantly moving your entire portfolio around, but making some minor changes. Doing this may reduce your overall risk and volatility and potentially enhance your portfolio's returns. So at this point, you've got two options. You can continue to handle things on your own and hope and pray for a good result at the end. However, hope and prayer is not a good retirement strategy. Or you can work with a fiduciary investment advisor representative, such as myself, who has helped hundreds of retirees live out the lifestyle they've always planned for. If you have $250,000 or more in your portfolio and you'd like to have a professional develop and manage your portfolio, and you'd like to reduce the risk in your nest egg while potentially enhancing your portfolio's returns, then we could be a good fit together. If you're simply looking for more information and you want to handle things yourself, then I do wish you well, and hopefully you can implement many of the concepts I talked about today to improve your own situation. I work with retirees who are in or near retirement to address their concerns about retirement by implementing established investment management strategies so they can pursue the retirement lifestyle they've always strived for. I'd like to invite you to schedule a complimentary one-on-one consultation. Here's why this may be worth your time and what you should expect. At the completion of your consultation, you will have learned, number one, how much money you can save by utilizing lower cost investment vehicles. For some clients, this has meant thousands of dollars per year back into their pockets. Number two, how diversified your portfolio currently is and how it should perform during market corrections. Number three, how much risk you are exposed to in the market versus how much risk you are comfortable with. And number four, the appropriate amount of risk in your portfolio for the reward that you are striving for. And number five, how to construct your portfolio so that it is very tax efficient. After you've scheduled your consultation, I will call you on the phone or a Zoom meeting if you desire at the time that you have requested to discuss your concerns about your retirement. The initial consultation will last about 30 minutes. I look forward to speaking with you. Please click the button below to book your consultation with me today.